Hello everyone and welcome to Gen 126. This is Occupational Health and Safety and this is our final assignment of the course. This presentation was done by Group 10 and the members are Sharon, Sandeep, Takwir, and myself, Marie. So our main topic is needlestick injuries. So what is a needlestick injury? A needlestick injury is the penetration of the skin by a hypodermic needle or other sharp object that has been in contact with blood, tissue, or other body fluids before the exposure. So, for example, now that we are in the pandemic and there are many vaccinations clinics, imagine that a nurse or a doctor is giving you the vaccination and forgets the correct disposal of this needle. And then another person comes and or another doctor comes and is punctured with this needle. This can lead to serious problems, serious health problems. And even though the acute physiological effects of a needle stick injury are generally negligible, these injuries can lead to transmission of blood-borne diseases, placing those exposed at increased risks of infection from disease, causing pathogens such as hepatitis B virus, hepatitis C virus, and human immunodeficiency virus. Among healthcare workers and laboratory personnel worldwide, more than 25 blood-borne virus infections have been reported to have been caused by needlestick injuries. So there are extensive lists of all the infections that can come with a needlestick injury. So I like to point out this picture here that says sharp injury. And there are like some steps that you have to go through. The first one says bleeding. You have to stop the bleeding. And then you have to wash it, like properly wash the injury, and then cover it to prevent infection or getting worse by the germs around. And then you have to report it. You always have to report the injuries that you have because there are a lot of steps that you have to take into account at the moment that this kind of injury happens. So in Canada, the National Institute of Occupational Safety and Health estimates that needlestick injuries occur 69,000 each year. New staff or those unfamiliar with using needles or other percutaneous equipment have more needlestick injuries than experienced workers. Health Canada notes that 41% of injuries occur during use, while 95% occurs post-use. So clearly you can see that the problem is with the disposal. When you finish using the needle, you have to take them where they belong to. So the Alliance of Sharp Safety and Needlestick Prevention has found that 80% of sharp injuries can be prevented with the use of safety engineered devices, worker training, and worker practice control. If these steps are taken, these injuries can be reduced by 90%. In the years 2003 and 2004, the Michael Garron Hospital, that before was called Toronto East General Hospital, reduced their injuries in blood collection and patient injection by 80% by using safe sharps. So the safe sharps are a plastic, like a plastic cap that is in at the end of the needle. So once you finish using it, then you can put the needle in the cap and then put the needle in the proper disposal. So the prevention But needlestick injuries should focus on those healthcare workers that are at most risk. For example, surgeons, surgical staff in the operating room, etc. There are some basic approaches to take to use tools likely to lead to a sharp injury, such as taper point surgery, needle safety engineered scalpels, needleless connectors were introduced in the 90s to reduce the needle stick injuries. Another one is to increase personal protective equipment, such as the use of 2 pairs of gloves, etc. Finally, education with training for athletes, care worker can reduce the risk of needle stick injury. So this is really important because I think that if you are properly trained, you won't make that mistakes. It doesn't mean that one day maybe you can forget because you're in a rush or something like that and you forget to do it. But if you are trained to do so, you won't make the mistakes many times. And I don't know if you have seen that this container is in a lot of places, in public washrooms, hospitals, everywhere. And this container is to put needles. For example, people with diabetes that always have to get the insulin shot. So they use it and they have to dispose it here. That can reduce that. Because imagine that somebody had a shot in a public washroom and then forgot to do the proper disposal of the needle and somebody else go in and got punctured. Like nobody knows what kind of illness or something like that has that the person that did the needle there. And that person needs to have many exams, many blood work to see if he's safe or if something was transmitted by this needle. So it is pretty important that we educate ourselves and take seriously the needlestick injuries. So this is everything from me now, and my peers will continue with the presentation. I hope you enjoy it. Thank you so much.
Hello, today I'm going to be talking to you about the questions. So the first question is, what would you do differently if you were in Naomi's place? So I would first calm myself down and call for assistance. While I had assistance, I would put on my PPE and discard of the needle. That way it cannot harm me or any of the staff members or especially my patients. The second question is, how can you identify a hazard such as an open needle stick? This is an environmental hazard. It's an environmental hazard because although Naomi is working in a hospital with many different hazards, she has the ability to prepare herself before any patients come in, regardless of any health related issues. The third question is, how can you inform other people what to do if they were to be in this situation? Training staff before and even during staff is hired, they have to take tests in order to ensure that that they understand the safety of themselves and the other and people around them, especially if they are working in a place such as a hospital with many different hazards. What is the right PPE to use while handling a hazard such as an open needle stick while working with a patient who has a seizure? I would first put on protective gloves, gowns, and knowing how to disassemble a needle and discard it in the right hazard box. Protective gloves are used to protect your hands from getting injured while trying to disassemble a needle stick, and gowns are used to protect your clothes from getting contaminated and spreading across the building. The last question is this hazard preventable, and if so, how? Yes, this hazard is preventable in many ways. We can start with the management. Not having enough staff could also led to Naomi having no assistance with her seizure patient. Naomi should be prepared as a nurse to handle things on her own, especially under pressure. Because she works at a hospital, there's many different situations where doctors and nurses have to work under pressure. She should also know how to prevent injuring herself and discarding contaminated medical equipment such as a needle stick. And that'll be all for my presentation.
Hello, so today I'm going to talk about the analysis of the case study. So in this case study, the four deep analysis for the Needlestick case study, we choose the domain effect. In the domain effect, one negative outcome can create another negative result. In our case, the nurse had a needlestick injury because of her hasty approach. This error resulted in huge blunder because which could lead to many unknown infection or disease such as hepatitis B virus, hepatitis C, and human immunodefense by HIV. In this case scenario, the stakeholders are nurse. She was in a hurry and got needlestick injury because she was worried about the patient who had seizure, and she didn't pay attention regarding needlestick injury and didn't go for blood test immediately. Furthermore, she didn't inform the medical administration right away after the incident. And the second stakeholder is medical administration. They are also responsible for this incident because they had a shortage of staff. Usually when a seizure patient get admitted to the hospital, it is very hard for one staff member to handle it. During that incident, Nomi, who was the nurse, was alone and she tried to handle and in a rush, which led to a drastic accident. Employer is a third stakeholder in this case study. It is her and his responsibility to provide blood-borne virus insurance for the all employee working in the organization. The stressor in this situation are like Nomi failed to separate her professional and personal life. Shortage of staff is the second stressor in this case study, and the behavior of the Nomi, she just start panicking, and because of that, she got the needlestick injury, and the other was a heavy load. And the solution for this case study is the organization should hire the medical professional according to the number of patients that come to the emergency every day. If there is any critical case such as accidental or seizure patient, at least 2 or 3 nurses should attend them rather than one staff member. The organization should make sure that the employee are getting their day off on time because it can keep them mentally and physically healthy, and it also have to prevent workplace burnout. So this was the part that I presented, and my name is Sandeep Kaur, and the student number is 3011707745. Thank you.
And this is Sharon here, and for the conclusion part, the needle stick injuries occur when the skin is pricked by a sharp needle and the needle comes in contact with the body fluids. If the action is not taken immediately, it may lead to infection. The healthcare system of Canada came to a closure that the main reason for these injuries occurred to those who aren't well trained or have less to no experience. The Alliance for Sharp Safety and Needle Stick Prevention came up with these injuries that could be prevented by encouraging the training for the workers, by applying proper safe engineering practices, and promoting safety control practices. As we know that the needle stick injuries are common in the healthcare facilities, the organization should have strict rules and regulation regarding the handling as well as discarding the sharp objects. As a healthcare worker, we need to take responsibility and be accountable of the errors we do. It is our part to make sure that we protect ourselves and our community. For the last slide, which is suggestions for improvement, each and every medical organization should be trained and educated on how to prevent needle stick injuries. We as a healthcare worker need to be more alert and conscious while doing the care of the patient or residents or clients. We should always inform the incidents right away to the supervisor and the employer. It's also good to investigate all sharp-related injuries. Staff or workers should use the proper PPE, such as gloves and boots, to prevent sharp equipment injury. And lastly, provide post-exposure medical evaluation. So that's it for a presentation. Thank you.